So first, we have the types of muscles. We have 3 types of muscles, okay? The first is called skeletal muscles. Second is cardiac muscles, okay? And the third is called smooth muscles. Can someone tell me which of these muscles are voluntary?
Skeletal.
muscles.
Skeletal.
Yes. The other 2 are involuntary. Where do you find smooth muscles? Can
In viscera. Internal viscera.
Yeah. And glands in internal viscera. That means, like, let's take our digestive tract. It sends food forward by a process called peristalsis that is done by muscle contraction. We don't control that, okay? And cardiac muscles is in the heart. It has automaticity. That means it can contract on its own. It does not need a nervous signal. The other 2 types need a nervous signal. So what happens if the nervous signal is damaged? Can someone tell me what will happen if the nervous signal to the muscle is damaged?
No contraction will take place.
No contraction relaxation.
And what will happen in the long run? What will happen to the muscle over time?
Fatigued. They will trophy.
Wastage of muscle. Atrophy. Atrophy.
Exactly. It will atrophy. That means it's going to just waste away. It will become smaller, and basically they will die away. And the thing about skeletal and cardiac muscles is they are permanent muscles. These are permanent tissues. If they die, they are gone. There's no more new muscles that are going to come. So basically, what does a person who goes to the gym do? Increase the size of the skeletal muscle fibers. Okay? You stress it and cause a condition called hypertrophy. Okay? You increase the size of the muscle. Okay? So that's the first part. Next, I want to talk about the structure of a muscle. Okay? First, our muscle is made up of the main part of the muscle is called the belly of the muscle. So that's what I drew here. So basically the belly is the part that contracts. This contracts. So what does contract mean? Is it going to increase the length this way or move the length this way?
This way. Second one.
Second one, yeah. Okay, it is going to contract. Okay, next, what attaches a muscle to the bone? It is called a tendon.
Tendon.
Okay, there's a reason why you call these skeletal muscles. That is because these muscles attach to the skeletal system. Okay, so this is the structure. A tendon is what connects the muscle to the bone. Okay, it's made up of dense connective tissue. It's a white fibrous connective tissue. Okay, those who did pathology for GI tract with me, they know that word. Okay, dense connective tissue. You will learn this for histology. So it binds to the periosteum of the bone, the outer region of the bone. Okay, and what do you call a large tendon? A large tendon is called an aponeurosis. We'll learn that over here in the head. In this region, there is going to be a muscle. There's going to be a muscle called the epicranius, and joining and touching the cranium, don't worry, we'll come here, I'll draw it again, is called the gallia aponeurotica. Gallia aponeurotica. Okay? It's basically a long tendon. Okay. Next, I want to talk about the attachment of the muscles. So it's going to join in two places. Okay. And the best way I remember that is by taking the chest muscle. Okay. So if you go to the gym, the people who go to the gym, they will know that this region of the chest is the most hardest to build. This region is the one that builds the most. Why is that? The origin of the muscle is the sternum. Okay, it comes from here and it moves here, goes this way. So this region is immobile, it doesn't move, so it won't feel the stress. Okay, that is called the origin of the muscle. And the one here, it inserts onto the shoulder, that is called the insertion of the muscle. So when you do this movement, this region, you can try it yourself, this region, the insertion point, it doesn't move, but this region, you can feel the movement. Okay, did you understand that? Okay, that's the origin, the immovable end, and the insertion. And for NMU, you do not need to remember these. Okay, wherever you see this is the insertion, this is the origin, you can skip that part when you study, but it's best, I'll tell you the ones you need to know basically. Okay, so there's a classification of skeletal muscles. There's, like you did for bone, you get, let me write it. So the classification of skeletal muscles, you get long muscles, you get short muscles, you get flat muscles, and orbicular muscles. Okay, I'm going to ask a question. What does orbicular mean? Does it mean related to the eye, or does it mean it's circular?
It's circular.
Yeah, okay, it's a circular muscle. And can someone tell me 2 locations where you can find those?
Eyes and lips.
Exactly.
As a bit, yeah, Orbicularis.
Yes. Okay, in the eyes and in the lips, this movement is done by the orbicular muscles. Okay, flat muscles, you get it in the head, like the frontal region. That's a flat muscle. Okay, long muscles, the biceps, triceps, all of those. Okay, next I want to talk about something called fascia. Okay, so if you eat chicken, you guys know there's this white color thing. If you cook chicken, you need to pull that out. The white color thing which is stuck to the chicken, you need to pull that out. That is actually the fascia. Okay, so what does the fascia look like? You're going to get a very complicated structure in the PPT, but I'll simplify it for you. So we have the muscle, okay, and we have 2 types of fascia. One is called the deep fascia, which is going to be basically wrapped around the entire muscle. It will be wrapped around the entire muscle. This is called the deep fascia. Okay. Next, above that, you have the superficial fascia. Okay. This is basically made up of fat, and you find it just below the skin. Okay. So basically, the function of the superficial fascia is it acts as a cushion. Okay. So one function of fat is it has a cushioning effect. You go and hit a fat person, it'll bounce back and hit you back. Okay. So remember, fat has a function of being a cushion. The deep fascia, it's made out of white fibrous. Remember the chicken fascia, connective tissue. And the importance of this is it is going to form functional groups of muscles. So what does that mean? So in our chest alone, you have different muscles. So in our chest alone, you have so many muscles. Without the fascia, it will just be one huge mass. It won't be separated into different functional parts. Okay. You can't call it, okay, pectoralis major, pectoralis minor. You can't differentiate that. Okay. It will be just one huge blob of mass. Next, I'm going to talk about the muscles of the head. Okay. So the facial muscles. Can someone tell me the function of the facial muscles? It's in the name actually. There's two types of muscles.
Expressions.
Sorry?
Expressions.
Yes, facial expressions. All these are done by the muscles of the head. And the first one is called the epicranius. The epicranius, epicranium. Okay. It connects this region to the back of the head. I'll teach you to draw these. For now, I'll just tell you the function of that muscle. It has two parts, the frontal belly. Remember, this is a flat muscle. Don't go to memorize what is a flat muscle. Don't go to memorize what's a short muscle. It's pretty obvious, okay? If they ask you, you should be able to just tell based on looking at it, okay? The frontal belly, it does this two things. You can see it wrinkles the forehead and elevates eyebrows, okay? Next, you have the occipital belly that is in the posterior region of the head. The occipital lobe is the most, it's actually, wait. Yeah, it's in this region. So basically, there's a tendon which covers the top. There's no muscle here. It's just a tendon. That's called the Gallia aponeurotica. Okay. It moves it backwards. Next, you have the Orbicularis Oculi. So what does that do? It closes the eye. Okay. It's around the eye. So we'll start drawing it now. Just draw something like this and label this muscle as epicranius. Okay, this muscle. It's outside the cranium. Just remember it like that. Epi is always going to be the most outer layer. Okay, epiphysis, diaphysis, and epicardium. It means the outermost layer, and it is outer to the cranium. Cranium is the bone of the skull, basically. This region of the skull. Next, the Orbicularis Oculi. Oculi means eye. It is something to do with the eye. So this is the Orbicularis Oculi. I gave him pink eye, basically. And next, Orbicularis oris. Okay, that helps you pursue the lids. Okay, and the buccinator, you can't feel it, but you can basically try to compress the cheeks. You do that. Okay. So this is the origin and the insertion. Originate from the bones of skull and insert onto skin. That's why the skin can move. Okay. Next, the masticatory muscles. What does that mean? the muscles involved in chewing. Okay, so there's 4 muscles. The first one is called the masseter. Masseter, you can actually feel it. You can tighten your lips and you can feel the muscle on the side. Okay, that's the masseter. Its function is to elevate the mandible. Okay, remember, without the muscles, our mandible will be like this. It will be just falling down. So the masseter, it elevates the mandible. It brings it up. Okay, actually 3 muscles do that. 1 muscle does the opposite of it, brings it down. Okay, remember, 3 muscles elevate the mandible, and the 4th one is going to bring the mandible down. Okay, so here is the location of the masseter. Can someone tell me where the temporalis muscle is? Can someone tell me where the temporalis?
Right above the head, right above the ear.
Yeah, this region. This muscle is called the temporalis. Okay. This muscle is called the temporalis. Okay. Same function. It elevates the mandible. And the last 2 are actually deep muscles. So basically you can't see them. Okay. You get them. Let me show you the location. You get them in this region. Okay, so okay, one is more medial, the other one is more lateral. Okay, that is called the pterygoid muscles. I'm giving you time to write. Okay, because I have already written these. I'm giving you time to write these. Okay, so I'm just looking at the people and deciding the speed. If I'm going too slow, just tell me, okay? Or if I'm going too fast, but also the pterygoid muscles are involved in side to side movement. Okay, both pterygoid muscles do that movement. Okay, so shall I? Yeah.
Can we have a fracture of the mandible?
Sorry.
Fracture of the mandible. Is it possible? Like,
it is possible.
Like what is possible?
Yeah.
So what happens when there is a fracture of the mandible? Which is the ligament or destroy, or is it like the bone is fractured itself?
Usually more than a fracture, you get something called the dislocation of the mandible. Okay, because let's say you punch this region, our mandible is the only bone which is not connected, which is not a part of the skull. It's found attached separately. Okay, so basically if there is any movement, like if you hit a person in this region, the mandible will be moved this way. It's not a fracture. You can basically bring it back and fix it. I have actually seen that, but basically it's not a fracture. It's not going to cause long-term. It's not like a bone fracture where you need to wear the cast for a long time. But basically you need to bring it back. And
it's just a displacement, right?
Yeah, it's a displacement. Basically,
it's a dislocation.
Sorry?
It's a dislocation.
Yes. Okay. Next, we have the muscles of the neck. Okay. So first I'll teach you to draw these, then I'll explain these. I didn't keep any space for the medial muscles, so you'll have to draw it in the superficial region. So first I'll show you how to draw the superficial muscles. Okay. Basically, we have two muscles. One is called the platysma. It is basically something like a curtain, a cover. Okay. And then you have the sternocleidomastoid muscle. That is inside that. You can't see it except for a small portion. But platysma is a flat muscle. You can look at this diagram and you can see it's a flat muscle. And the sternocleidomastoid is actually a big muscle, which when you move your head to the side, you can feel it. You can feel the muscle here. Okay. This is the sternocleidomastoid. Okay. This is the sternocleidomastoid. And this is the platysma. Okay. So platysma is also a muscle of facial expression. Okay. And it helps depress the lower lip. Okay, I'm not talking about the mandible. And you can wrinkle the skin of neck. 3 functions. Okay. Next, sternocleidomastoid. You will learn this a lot when you do the nervous system. There's a nerve which innervates it called the, can someone tell me?
Accessory.
Accessory nerve. Cranial nerve 11. Give me a second. Sorry. So I will tell this now, but don't go to remember this because you need this when you do neuroanatomy. But this is called the accessory nerve. Cranial nerve 11. Okay, that supplies the sternocleidomastoid muscle. So if there's damage to that nerve, you can't turn. You ask the patient to turn on his own, he can't turn it. Okay, remember that. And can someone tell me where just think, I'm not asking you to memorize anything on tell, where is the insertion and where's the origin? Is this the insertion?
Occipital.
No.
Insertion is right.
It's below the clavicle. So this region, it joins with the clavicle. But this is the insertion, the origin. This is the insertion. Okay. Look at the muscle and decide. So for the biceps, which is the insertion? Is it in the shoulder or is it in the forearm?
Forearm.
Insertion is in the forearm. Origin is in the shoulder. Okay.
Shoulder.
It's pretty obvious for most muscles, so don't worry, and they won't ask you. Next is going to be the hard one, the medial part. The muscles in the medial part are going to be divided into 2 regions based on the hyoid bone. Okay, medial muscles. So do you know what the most highest paid job for a person, for a doctor in USA is? Like which field is the most highest paid job?
Dentist.
Plastic surgery.
Plastic surgery is number 1. What is number 2? It's orthopedics. Okay, that has got to do with skeletal system and muscles. Like basically you break a bone, you go to that department. So that is the second most paid department. Okay, and this is the part in which our university focuses the least on. So after you learn anatomy, you will not learn anything to do with the skeletal system or the muscles till probably the 5th or the 6th year. Okay, you won't learn anything related to this. So try to remember this. Okay, we don't learn what osteoporosis is. Just think. I think we'll learn it in the 5th year, but till then we haven't learned it. So we have the hyoid bone. Draw it with me because it's a 3D diagram. This is the hyoid bone. Okay. Wait, give me a second. Okay. So the first muscle we are going to do is called the digastric muscle. Okay. It has a V shape. Okay. It has a V shape. It's a V-shaped muscle. You can see it here. This muscle over here is the digastric over here. They have cut one away, but basically you have another one like this. Okay, this is the digastric muscle. Label that. Okay. Next, you have the mylohyoid. Okay. So the mylohyoid, this is the mylohyoid. Digastric. So you have two muscles which are called suprahyoid. Suprahyoid. Superior to the hyoid bone, you have two muscles, and we have 1, 2, 3, 4, 5, 4 muscles which are infrahyoid. And the way you label the infrahyoid muscles are based on its attachment, where it is going to attach to. Okay. So next I'm going to draw the sternum. Okay. And this over here behind it, I'm drawing the thyroid cartilage of the larynx, basically the larynx. Okay. And over here, I just want to finish drawing the bones. The scapula. Okay. So draw this with me. I'm going to draw the muscles now. First, we have the muscle that is going to touch the hyoid bone and the sternum. This is called Sterno Hyoid. Sterno Hyoid. Okay. Next, we have the bone that touches the sternum and the thyroid cartilage of the larynx. This is called sternothyroid. Okay. And another muscle from the hyoid bone which touches the thyroid cartilage called thyrohyoid. Thyrohyoid. And finally, we have a muscle that is going to join from the scapula to the hyoid bone. It's called omohyoid. Okay. Draw these with me because I'm going really slow. Now let me show you the bones, the muscles. So this is the thyrohyoid. And can someone tell me what this muscle is? What I just marked here. Guys,
Omohyoid.
yes.
Omohyoid.
Yes. Okay. Can someone tell me what this? Okay, this is going to be okay. Look at this carefully. Look at the insertion of that muscle and tell me, is this the sternothyroid or is this the sternohyoid? The hyoid bone is here.
Sternohyoid.
Sternothyroid.
Sternothyroid, okay? Sterno. And this is the sternohyoid. This is the hyoid bone. You can't see it, but it's in this region, okay? It's here, actually. Okay. And finally, the deep layer. So the deep layer.
John, if you go anterior,
Sorry?
if you go anterior to posterior view, first we'll have sternohyoid and then behind it we'll have sternothyroid, right?
Actually, yeah. No, I don't get what you mean. You mean from anterior to posterior? Huh?
Yes, exactly. The first we'll have
The sternohyoid. Look at this. You can see this is. See? You can see this muscle is more anteriorly. Actually, both of these muscles are in the anterior region. When you cut open when you do dissections, you will see that. But basically, what we are going to do is we are going to destroy those muscles when we go deeper. Do you remember? Okay. So one is more on the lateral aspect. The sternothyroid is actually more medial. Okay. One is coming from the lateral aspect of the thyroid bone. The other one is more medial. So the muscles, digastric muscle, it opens, open the mouth or elevate the hyoid bone. Okay. Brings. I don't know if you can feel it, but you can actually feel the digastric muscle contracting when you open your mouth. You should be able to feel it over here, just below here. You should be able to feel it. You open your mouth fast, you should feel it. Okay. The mylohyoid is formed in the floor of the mouth, basically above, like more above the digastric muscle. It does the same thing. It elevates the hyoid bone and aids swallowing. Okay. This make sure that the hyoid bone doesn't fall down. Okay. The infrahyoid muscles, just remember the names. Okay. Names and the insertions. Basically take it from the name itself. So sternohyoid, the sternal cartilage of the larynx. Omohyoid, you will learn the structure of the larynx. So it's a huge part. It's going to be one of the hardest parts in anatomy. It was for me, basically. Omohyoid, scapula to the hyoid bone, sternum to the thyroid cartilage, and thyroid cartilage to the hyoid bone. Okay. Just remember basically remember the names, and you can tell where it's going to insert to, but they won't ask you for NMU. So that's why I didn't go into detail here. Next, we have the deep layer. So let me take it. We have the cervical vertebrae. We have our vertebral column, cervical vertebrae. Okay, yeah. And we have the first rib. This is rib 1. Okay. Now, give me a second. And we have, let me draw rib 2 also for the sake of completion. So first, we have the scalene. These are called the scalene muscles. We have the scalene anterior that is going to go and insert onto the first rib. Okay. Anterior. And then we have the scalene medius that is also going to insert onto the first rib. It joins. Okay. And finally, you have the scalene posterior. It is going to join to the second rib. Scalene. Okay. These are deep muscles. You can't see them. Okay. And what you need to know here is the brachial plexus is going to go between here. There's a, okay. Let me use yellow. There's a structure called the brachial plexus. It's going to go between these regions, right? So just draw it first. I'll explain it. This is called the brachial plexus. And there's the subclavian artery, which is going to go between the medial, the anterior, and the first rib. Okay, this is the subclavian artery. Let me take a diagram which I drew before and keep it here. It'll look better. It looks better actually. Okay, look at this. This is the first MCQ point I'm going to give you, which you will need for NMU. They are going to ask you about something called the scalene space. Okay. So what is the scalene space? It's basically the space between the medial. Look at this. Think of this as a circle. Okay. I'm going to highlight it as a circle. But basically the space between these three, rib 1, the medius, and the anterior. Okay. And what goes through this is the subclavian artery and the brachial plexus. Okay. Remember that they love to ask you these spaces for MCQs. Again, I hope you understood that. Okay.
Can you please repeat what passes through the space?
Okay. So two things passes through. One is from the nervous system. It's called the brachial plexus. Don't worry about it. Don't. You will learn this for the nervous system. So it's called the brachial plexus. And the second one is the subclavian artery. Okay. Scalene space. It's the space between medius, rib 1, and the anterior scalene, and through it you get those two structures. That's all you remember. Okay. It shouldn't be hard. Next, I'm going to do the muscles of the back And this is for the people who go to the gym and want to build up their muscles. So basically, one muscle they need to build is this muscle over here. Can someone tell me what this muscle is called? The neck muscle.
Deltoid.
No, the deltoid is this. It's the trapezius. It's the trapezius. Okay. So if you guys are interested in stuff related to the gym, the trapezius. Okay, so in the diagram here, it's not actually there, it's taken out, but basically it comes from here. You can see the place that it was supposed to be. Okay, so it basically comes like this and is a muscle like this. Sorry. It's a muscle like this. I'll teach you to draw this, don't worry. This is called the trapezius. And this nerve, this is also innervated by accessory nerve. Okay, cranial nerve 11. It means cranial nerve 11. When you learn it, it becomes easy. So don't worry, by the time you have the exam, you will have learned these. So seeing abbreviations like CN, you will immediately know what it is. Okay, cranial nerve 11. Next, we have this muscle. This is called the Erector Spinae. And you can see that this is literally the longest muscle in our body. It goes from the neck region all the way down to the thoracolumbar fascia, which I will show you in a while. But this is basically very long, the longest muscle of the body. Okay. Actually, it goes through the thoracolumbar fascia downwards. This is the long. Write it as longest back muscle. Okay. And finally, we have the Latissimus Dorsi muscle. That too is removed. If you look at it here, this is called the Latissimus Dorsi. Okay, and this is the most broad muscle of the body. The reason I asked you to write back muscle is because that's how it's given in NMU. So those who go to the gym, I don't know. You can, those who have the muscle here, they can actually contract this region and they can feel it. You can feel the muscle. So it actually inserts all the way to the shoulder. Okay. Let me just tell you the functions of the Latissimus Dorsi. Here are the functions. It rotates the shoulder. It adducts shoulder, extends, adduct, extend, and pulls back the arm. Okay. These things, the reason I'm giving you the functions of these two muscles here, especially the trapezius, is because you need to know that when it comes to diseases. Okay. So if there's damage to the cranial nerve 11, how you ask a patient, okay, I gave you two muscles. One is the, what is the muscle I gave you? Sternocleidomastoid. The other one is the trapezius, which is innervated by the accessory nerve. So you ask a patient, This is how you check for damage to the nerve. You keep your hand behind him, from behind him, and you ask him to raise the scapula. You ask him to do this movement. If one side of the nerve is damaged, they will be doing this. They can't move the other side. If both are damaged, they can't lift anything. Normally, you can do this. The other thing, you ask the patient to turn to the side. Okay. Can someone tell me which muscle contracted? Is it the side I turn to, or is it the other way?
Opposite side.
What do you mean by
The other one, when you turn this way, the one over here will get contracted.
The side you're turning to, that muscle gets contracted.
Yes. Okay. Don't go to memorize these. Just remember that. You can do it yourself and figure those out. Okay. So basically, if you can't move it this way, that means the nerve coming from this side is damaged. Okay. See, that is called clinical anatomy, and that is how we are going to progress. I can't give you that till we actually learn a bit more. Okay. But for the skeletal system, it's all about breaking bones and stuff. That we can do clinical anatomy. So I'll teach you to draw the muscle. So basically you draw a human. Sorry if I'm too slow. If you want me to go faster, just tell me. Okay. See, the first thing is I'm not an artist. Again, 3 muscles. Okay, kept space for that. Wait. Let me start off drawing this. This is called the thoracolumbar fascia. Thoracolumbar fascia. And this is also a very important structure which you will get for your exam. So the trapezius is actually not going to be part of this. It's just above that, okay? Don't worry, I'm going to discuss the thoracolumbar fascia. Okay. Next, inside, we have the Erector Spinae muscle. Wait, don't draw the Erector Spinae muscle because I didn't draw it yet. This is the Erector Spinae. It is next adjacent to the spine. Okay. And finally, we have the Latissimus Dorsi. Okay. Three muscles. Do you want me to go into the muscle movements? I talked about the trapezius. One more thing, it pulls the head backwards. Okay. And it helps pull it to a side, but forget it for this. Remember it for the sternocleidomastoid. Adduct, extend and rotate the shoulder, latissimus dorsi. I told you it connects to the shoulder. Okay. I'm not going to go into detail there. Just remember it moves the shoulder. Okay. And the erector spinae helps keep the spinal cord straight. Okay, that's it for that. Now I want you to learn to draw the thoracolumbar fascia, because it's going to be a very hard thing to understand if not. Okay, so first draw it with me. This is the vertebrae. Okay, this is our body of the vertebrae. Let's take the L4 vertebrae, lumbar 4th vertebrae. I'm just gonna draw it like this. Okay, can someone tell me what this is? This region is in the vertebrae?
Spine.
Yes, the spinous process.
Spinous.
And
process.
which side is going to face the anterior aspect of the body, which is more posterior? Which is the posterior side?
Final one is the posterior.
Yes, always remember this. Anywhere where you see the word spine, it is going to be talking about the back of the body. It is going to be pointed outwards. Okay, this is the spine. I'm not going to talk about it. Now in this fascia, now I'm going to draw the fascia. There are 3 parts. First, you have a part that originates from the middle of the transverse process of the rib. Next, this is called the anterior layer. Okay, remember anterior. This is going to be the posterior layer. Okay, and next we have one that comes from the transverse process. This is the medial intermediate layer. You can actually call it medial layer also, doesn't really matter, but in NMU they call it the intermediate layer. And finally you have the posterior layer. Learn to draw this, otherwise you won't understand. Let me show you the diagram which they have for NMU. I'll send it to the group, you can check it. So this is the diagram they have for NMU. It's not easy to understand that. Okay, so these 3 will join together and it'll give rise, they will join together more anteriorly. It'll give rise to the muscles in the front of the body. This is the interior oblique, internal oblique. And this is the transverse abdominis. Two muscles. So learn to draw the fascia. This is the fascia which I drew. What is the function of the fascia? Of the deep fascia?
It forms group of functional muscles.
Yeah, exactly. So the deep fascia is going to be doing just that. We have, remember, what I drew in red is going to be the deep fascia. If you want, I can draw the superficial fascia, which is just under the skin. If you want, you can draw that, but that's not important. Okay, just draw it, just draw it. Superficial fascia. Label it somewhere down here because I need the space over here. This is superficial fascia. And finally, this is called the this is going to be the where the interspinous ligament. This is not needed for this section, but you need to know this. They will ask this question: how do you do a lumbar puncture? What are the layers you go through when you do a lumbar puncture? We'll be discussing those. So this muscle is called the Quadratus Lumbricoids. I'm just going to write it as QL. Quadratus Lumbricoids. If you want, write it down or just write it as QL and put the abbreviation here. Okay, you can do that. And in this region, we have two muscles. Okay. And finally, this is called the psoas major, P-S-O-A-S major. It joins with the body of the vertebrae. Okay. Actually, there's two more muscles. Actually, I'm going to leave those two out. You don't need those. But basically, the Latissimus Dorsi is going to connect somewhere here. Okay. It's going to be found here. But forget that. You don't need that. Okay. So the note, the superficial layer covers the Erector Spinae. Okay. So basically, what has happened is NMU has decided not to talk about this muscle, but it's actually there. It's a muscle which is there. I just read the note, so basically they don't want you to know that. It's useless. The intermediate layer between the Erector Spinae and the Quadratus Lumbricum. Deep layer anterior to Quadratus Lumbricums. Okay. Now look at this. In the exam, they will ask you MCQs. They will ask you the location of the intermediate layer. If they ask you that, actually this is for the long answer questions. Describe the thoracolumbar fascia. They might give it as fill in the blanks. Okay. So if you don't know, to draw this, you will have to memorize this. And memorizing this is just going to be words. There's no understanding there. Okay. If you look at this, can someone tell me the location of the intermediate layer? Don't look at the note. The location of the intermediate layer. Can someone tell me that? Okay, let me do one, then you can do the rest. The intermediate layer is between the Quadratus Lumbricum and the Erector Spinae. Okay. Where is the Quadratus Lumbricum?
Between anterior and intermediate layer.
Of the thoracolumbar fascia. Okay. Don't leave that part out. And where is the psoas major? Okay, now this is hard. This is hard. Talk about anterior and posterior and tell me. Use those words and tell me.
It
Okay.
is
Yeah.
it is on the anterior side of the.
Yeah, correct. It's anterior to the anterior layer of the thoracolumbar fascia, and it joins with the vertebral body. Okay. Don't worry, you'll get better at it with time. Do you understand this? Can someone tell me the location, the joining point of the transverse abdominis muscle? Describe the joining point of the transverse abdominis muscle. the origin point of the transverse abdominis muscle? Can someone tell me that? They won't ask this, but basically you need to be able to describe anatomical.
At the junction of the thoracolumbar fascia.
Yes, at the junction of the thoracolumbar fascia, or you can make it more detailed by saying the junction point where all three layers, the anterior, intermediate, and posterior layer of the thoracolumbar fascia join, you get the transverse abdominis. Okay. One more question. Will there be a fascia between these two? Okay. Will there be a fascia between these two? Yes. Look, this is why I said fascia is important. I talked about another muscle here. I deleted that because NMU doesn't want that. Did I show you a demarcation? Did I tell you this part is the erector spinae, this part is the other muscle? I didn't. That's what happens if there's no fascia. Okay. You won't know what is what. Next, we have the muscles of the chest, and this is for people who are trying to get abs, who are trying to reduce weight in that region. Actually, it's mainly for the boys who want to get abs. So basically, there's a fascia. There's a fascia, a very firm fascia in the rectus abdominis muscle, in the abs region. There's going to be a very firm fascia. Okay, so this, when you go for abs, when you train for abs, you need to train your diet, and you need to build that muscle. It's also a muscle that grows. Okay, but because of the fascia, when you exercise, you keep exercising, there won't be any growth because the muscle is going to be pumped up. It's going to go and hit the fascia, and it can't go further than that. It can't push the fascia away. Okay, so whenever you do abdominal exercises, between sets, always stretch. You need to stretch the muscles. You basically stretch like this so that you stretch the fascia to create more space to grow. Okay, that is for the people who want to build muscles in the abdomen. Finally, I'm going to talk about the chest muscles. Okay, I did a huge part of anatomy, especially this. It took us one whole period. It took us around 40 minutes just to discuss this. Okay, in NMU. I'm going to teach you the chest muscles. And if there's time, I'll just teach you to draw the abdominal muscles, and we'll end the class. So this is the shoulder which I'm drawing. I'm just going to draw one side, and deep here is going to be the ribs. Okay, I'm going to be drawing over the ribs, so yeah. First, we have the main muscle, the one you need to train to build your chest, the Pectoralis Major. Okay. This muscle is a fan-like muscle. This is called the Pectoralis Major. I'm going to give you the function over here. Just wait for that. Next, we have the Pectoralis Minor. That is going to be deep. It will be a deeper muscle. Okay. Next, we have a muscle called the Serratus Anterior. Just draw these. I'll explain these. Like And finally, the external abdominal oblique muscles, the external obliques. So if you have seen bodybuilders, you know that over here you get muscles that look like the ribs. That's the external obliques. Okay. I'm just going to add the functions of all these muscles. Actually, there's two more muscles. Wait. There's two more muscles which I want to give. Between the ribs. Can someone tell me the muscles between the ribs?
Intercostal.
Yes. There's two, external and the internal. This is just for you to write down, learn to draw. And okay, yeah. Okay, guys, I'm going to teach you how to remember these functions. It's not hard. All you need to know is you need to know the movement of the chest muscles. Look at this. All you have to do is do this. Okay. You should feel the chest move forward, and you can feel the scapula move inwards. Like it moves forward and downwards. Just feel it. You can feel the scapula moving downwards. When you do this, you should be able to feel the scapula moving downwards. Okay, just try it. Can you feel it? Okay. So that's the movement of the chest muscles. And look at it. Pectoralis major is the muscle here. Okay. That is going to move the shoulder this way. The others, the serratus anterior, which is found more in this region, it is going to attach to the scapula. Also the pectoralis minor, it comes like this. It is going to bring the scapula forward. Okay? Do you understand? Do you remember that? Huh? That's see, just move your chest and you learn a lot. First, the insertion point, the origin point and the insertion point. Insertion here, here. And you know the pectoralis major is going to do this. Minor is going to bring the shoulder, the scapula forward and downwards. Okay. Also, in patients, I'm not talking about normal people. Actually, we can take athletes also, but basically, these muscles help in. There are extra muscles which help in respiration, in inspiration. Okay. So then there's the intercostal muscles. I kept some space here for that. Does anyone remember where the nerves come? Is it from the top or the bottom of the rib?
Inferior border.
Huh? Inferior border, right? Yeah, thank you. I actually forgot that I wanted to ask it from someone. So basically, blood vessels, nerves. So what I'm drawing is actually the external intercostal muscles, nerve fibers. All these run along the inferior border of the rib. So this is the external intercostal muscle. External intercostal muscle. And inside that, inner to it, is the interior intercostal muscle. If you want, I can draw it like this. So if you look at the rib from behind, from this region, you will see the internal intercostal muscle. Okay. So this is the internal intercostal muscles. Okay. And again, remember, blood vessels and nerve fibers run along the inferior border of the rib. Okay, this is a rib. What does that mean? When you are penetrating, let's say there's a condition called thoracocentesis, or in which you remove pleural effusions. Okay. In that, we need to send a needle. We need to send a needle through the muscle into the pleural cavity of the lung. Okay. So if you damage these nerves, if you damage the nerve, when you send the needle in, what is going to happen? The external intercostal muscle will not be able to contract. Okay. Therefore, do you know how to search for your intercostal spaces? Just try it later, but basically it's not really the easiest thing. If you're thick, basically even between the ribs, just press inward into your body, and between the ribs, you should feel the space between the ribs. That space is called the intercostal space. And usually when you do the, when you send the needle in, you need to send it from the lower, from the superior border of the rib. Okay. Do you understand that? Never send the needle just below a rib. Okay. Remember that. And what is the function of the intercostal muscles? I gave it here. External intercostal muscles raise the ribs to aid inspiration. Okay. Upwards, upwards. Descend the ribs to aid expiration. That is the internal intercostal muscle does the opposite function. Okay. And I want to talk about the diaphragm. This is going to come as an MCQ. This region is going to come as an MCQ. So I need you to remember that. Okay. I don't have a picture of the diaphragm. Let me erase this. I'll move it aside. Okay, so the diaphragm, it is going to have 3 hiatus, basically 3 holes in 3 layers. At the T8 layer, T10 layer, and the T12 layer. This basically holes to allow anatomical structures to pass through. Okay. So at the T8 layer, you have the vena cava going up. Vena cava going up. Okay. Inferior vena cava, IVC. And in the T10 layer, you have the esophagus coming down. Okay. And in the T12 layer, so what are these I'm talking about? The 12th thoracic rib, thoracic spinal. Wait. Is it the rib or the spinal? Wait, I want to confirm if we are talking about the ribs or the spinal cord. Sorry, the vertebral column. I'll send a message about that. And on T12, we have the descending aorta coming down. There's an easy way to remember this because you're going to confuse these in your exams. Okay? You're going to be like, okay, did I just make a mistake or not? Thoracic duct is also there, but the main thing is the descending aorta. Count the number of letters. Sorry, wait. Give me a second. Okay, this is called the, yeah, count the number of letters here. Can someone tell me the number?
12.
12. Okay. This has 10. Okay. This has 8. Okay. Remember it like that. This is the British spelling where you add an E in front of O in front of everything. So this is for the people who did pathology with me. This is what I usually use, or what the American system uses. This is what the British people call it. You might hear this in Sri Lanka, in India. They call it GORD, gastroesophageal reflux disease. It's the same thing here. It's gastroesophageal reflux disease. Just because of the O, the way you pronounce it and say it is different. I actually got confused. Like I didn't know that. Next, we have the external abdominal oblique muscles. See, this is something I want to tell you. It's a broad muscle that comes here and comes to the linea alba. What is the linea alba? This is linea means line, alba means white. Okay, alba, albinism. These are Latin. There are Latin words you need to know. Linea means white, line, alba means white. Gauri, do you remember Prashant talking about the blue and the red color situation for a question? Anshu is here. Anshu, do you remember Prashant talking about white color, blue color for a question you sent?
Yes.
So those words are not hard. Those words look big, but it's basically the colors. Okay. Even I was like, yeah. Remember these words. This sentence, I will not do that now. Inguinal ligament and superficial inguinal ring. It's a huge part which you need to understand properly, because you get something called inguinal hernias, and this is also important for male testes descend through the inguinal canal. So for reproductive studies, reproductive health, you need to know these. I think for gynecology, they will teach us these. Actually, that's for the women's changes, but basically you need to know about this. This is a big part. I'll take around 30 to 40 minutes just to explain that. Okay. So that's it for today. If you guys have any questions, you can ask. Are you guys happy with this class? Like, did you guys understand that what was taught? Huh? Okay. So if you have any questions, you can ask. The important thing is you need to know the difference between clinical anatomy and the normal anatomy we do. So in clinical anatomy, they will talk about the cranial nerve 11 damage and ask which muscle cannot be moved. Okay. So for the final exam, the MCQs are going to be that type of questions. Okay. The MCQs for anatomy is actually pretty standard. Really, it's a really good standard. They ask all the questions in a clinical aspect. So you need to know your anatomy properly. And the main thing is don't go to memorize. Try to understand these. Okay. Like when you study this, try to move the muscles and figure out what's happening instead of trying to memorize that. That way you'll learn and not forget it for a long time. So that's basically it. If you have any questions, just send me a message. Okay. So
Sean, can you upload this file as well, like the one you just made the diagram, drew the diagrams on, like this file as well, if it's possible?
I will. The thing is, when I try to upload anything I draw on Notability, the file size is huge. So I'll have to put it on Google Drive. You guys can, I'll send the link. I'll send the link. No problem. Like these files will be like 17 to 40 MB. So yeah, if you have any questions, just send me a message. We'll stop the class now. Okay. Good night. Bye. I'll start the next class at what time did I say? 9 o'clock or
8:45.
Yeah, 8:45. Anyone can join. It'll be diseases of the liver and if there's time, pancreas. Okay. So good night. See you guys. Bye.